for you. Hi guys, good evening. This is Dr. Bhupesh once again from Dr. BKM OET Institutes. Just telling you what OET writing is in just 10 minutes. Means what OET writing is. At last, you want to know to whom you are writing the letter. So OET writing is basically writing a letter to a doctor, to a nurse, to a physiotherapist. So that means you have to understand to whom you are writing the letter. Suppose if I'm writing to a physiotherapist, then my data selection would be, or his muscles are weak, he had a fracture, he's not walking well, he needs assistance with mobility, he's having other problems, he's having problem related to neurons. If I'm writing to a psychiatrist, I will talk about mental condition of the patient. So it is very important first to realize to whom you are writing the letter. So in this case, this is a very specific letter which will tell you how to take care of the person whom you are writing and how to select the data. So write a letter to the director, aged care assessment team. So I'm just supposed to write the letter to a team who does assessment for the aged care people. Okay, simple. That's all good. So now plan. Plan word is very, very important. Even if it's a discharge plan letter, even then plan word is very important. Plan means request a home visit by the aged care. I'm writing the letter to aged care assessment team. So my plan is to request a home visit that should be done by the aged. That means I'm writing to this team only. So I will say it would be greatly appreciated if you could pay a visit, because I'm writing letter. That is what OET is all about. Understanding to whom you are writing the letter. So I'm writing the letter to aged care assessment team. So my plan is also to request this team to pay a home visit to the client as soon as possible to assess their needs. So I will tell the aged care assessment team, that is why you are an assessment team. So you need to assess these people, their needs, and to arrange appropriate further assistance that these people need. So if I have to write, maybe if I am supposed to write only this thing, okay, let me take it over there. First of all, let me close it. It will disturb me again and again. Yeah. Suppose if I'm writing it over here, so I would write this letter. Okay. Yeah. This again, I'm writing this letter. Let's make it simple. I'm writing this letter regarding जिनके लिए भी आप लिख रहे हो their name, regarding the names Mr. and that we will read later, Mr. and Mrs. this X and Y जो भी हैं Y. Okay. I'm writing this letter regarding Miss Y to, I'm writing this letter regarding Mr. and would like to request you your team to pay a home visit to assess their needs and to provide them same words and to provide further assistance according to their needs. Done. Simple. Home visit spelling I should be very careful about. That's it. So I'm writing this letter and would like to request your team to pay a home visit to assess their needs. Or you can say I'm writing this letter on behalf of, if you want to write a better word, on behalf of Mr. and Mrs. This, and would like to request. Simple means why to make it complex when OET is such an easy thing. Don't make it complex. Now the understanding is normally we always write the letter which are medical based, but let's see what kind of letter. But this letter is more of assessment. Said maybe they are unable to walk, so they need this thing regarding. Let's see what is the letter. Read the case notes, complete the letter as follows. 13th March is the date. You are a nurse with the Blue Skies Home Nursing. So I'm a nurse who also provide home nursing care. I'm a nurse who provide home nursing care. then why I'm writing to another team who's gonna pay a home visit? That means please try and understand these things. I am a nurse, I am already paying a home visit. Nurse would be taking follow-up care. So that means the other team that I am calling, either they would be a team who will provide follow-up care after me, or maybe they will provide some other care. If I am providing care for the dressing and everything, then why should I call other team to do dressing? So the work can be different. So please understand there can be some other things. So again, let's go forward and try to understand more. You visit the patient at the home today for the first time following a referral from the Spirit Public Hospital. He was discharged from the hospital on 17th. So patient was discharged on the 17th, and so obviously this date is wrong. It should be somewhere around 18th, because patient was discharged on 17th, so today's date can't be 13th. So it is misprinting, so I should say 18th. So maybe the patient was discharged yesterday. Okay. Henry O'Keefe is the patient, name of the patient. He stays on this date of birth is 1929, and admitted on 12. 12 means 1929 means 71 plus 12, 83 years old. Had a malignant melanoma on the left shoulder. Large lesion successfully removed. So lesion has been removed. Discharged on 17th, yesterday. Needs assistance with showering and dressing. Dress the wound prior to the removal of the sutures at Metro Public Hospital. So he needs regular showering and dressing. So this can be the purpose. This can confuse you, because normally we say na, needs means that is the need. That means this is the purpose. But he's saying, yeah, he has to remove sutures. Let's go ahead. So according to me, until now, purpose is showering and dressing. Until now. Then I go forward. In the final exam, that is how you approach a letter. Then you say, okay, marriage age pensioner lives in a housing home with a wife, and Miss Dorothy, aged pensioner. So patient is living with his wife. He had malignant loma on the left shoulder. Lesion has been removed, and he was discharged on 17th. And then 18th, first home visit was paid. Patient was showered. Patient was wound was dressed. So the showering of the patient was done. Basically, the patient was showered. Again, if you want to make a passive voice, simple passive voice is on 18th. Again, simple. If you want to, what I'm saying, you can write it as well in a simple way. On 18 March 2012, he was showered and wound was dressed. This is how simple you can write, guys. On 18th March 2012, he was showered and wound was dressed. Was plus third form. Present, oh sorry, past indefinite passive voice. Patient was showered, physiotherapy was given. So healing was satisfactory. No sign of infection. That means please try to understand the condition of the patient. Patient had lesion that has been removed, discharged. We are the nurse at the Blue Skies nursing home. We provide home care, and then patient does not have any infection, complaining of arthritic pains in hands. So glucosamine supplements are ongoing, pain relieved by the Panadol, confused about why he had operation. So I also need to understand the problem. If I am a nurse, I need to understand the problem. OET is about understanding the problem. So why he had operation? So there is a mental confusion. Dorothy concerned about the future. This is also a concern. Tells she will be 83. Husband is already 83. She will also become 83. Says Henry means obviously Okeefe had not been himself. So don't ever write in the present, because you have today's date as 19th. So I'm afraid to say 19th is also given. So we should take today's date as 19. So yesterday she was telling that Henry, Mr. O'Keefe, had not been himself. So I will always change this stencil, because this is about yesterday. So I have to make everything past. Had not been himself, past means second form, had kept forgetting things. She found it difficult to manage the garden and house. Neighbors were helping with the shopping. So this is the data of yesterday. That yesterday neighbors were helping, and she was telling that Henry. So today is 19th. So yesterday she was telling on 18th. Oh, Henry had not been himself. He's not doing well. I am also getting old. He's already old. We are struggling with the house, shopping, and dishes are piled up. Everything has been bad. So she mentioned everything yesterday. So today Again, that is the difference between past was plus third form when it is passive voice, and in the present tense is become. This is the only tense you have to remember when it comes to OET. These are the two. These are the two. Was plus third form means physiotherapy was given yesterday or any past visit. Today means patient has been showered. So the only thing changes today, the patient has been showered, wound has been dressed. So earlier we wrote patient was showered, patient was dressed. That is the only grammar. Today he has been showered by us, passive voice. And wound has been dressed. He is still little balanced. Rest you can put in simple active voice. He is still unbalanced. Does not remember anything about showering. So that means mentally he is not good. House is still, so you just keep on putting grammar. House is still disorganized. Then put is. House is still disorganized, piled up in the room. Dorothy says he would be lost without the help from the neighbors, who also appeared to be cooking meal for the couple. So that means the problem is that they are all lost. These are the concerns given separately, even to make your letter much easier, provided there are not complications with the wound healing. Your role in providing the nursing care ends. Now it is confirmed that I was providing the nursing care on 18th and 19th wound showering. So my role is going to end on 24th March. As 24th March, patient will go to the hospital for the suture removal. So my role will end. You consider that Jim and Dorothy need to be assessed for further ongoing assistance. So this is the word that you should quote. You are writing to assessment team. So Dorothy and Jim need to be assessed for further ongoing assistance in managing the house garden. So this is the main purpose of this letter. So you have to understand, how did I reach to this conclusion? Because I am writing to aged care assessment team. These people are aged and they require assessment of further ongoing in managing their house garden. These are the main things. Nursing care we are providing already. Now there is one more important thing. Some people say, oh, my job is ending on 24th March. So you can start the job from 25th March. My job I'm doing now, my job is taking care of the patient, dressing the wound. The other agency job is to clean the house, manage the garden. So they won't wait for me to end my job. So they can start from 20th itself. They can start from 20th. So I want to request a home visit. So the letter is all clear. You can listen to the video again and again. But now, when I write OET letter, I just write important things. For the assistance, so I will tell Mr. Okeefe. So I will put here, I'm writing this letter on behalf of Mr. Okeefe and his wife, Mrs. Keefe. Mrs. Okeefe. Otherwise, I could have said Mr. and Mrs. Okeefe. Would have been much easier. Sometimes we make it complex. See, by chance, I made it complex. Sometimes we don't realize we are making things complex. So Mr. and Mrs. Okeefe makes sense. And would like to request your team. Mr. Okeefe, Mr. and Mrs. Okeefe, both are very old. And again, make a story. Don't try to overdo it. Simple. And recently, that is on 14th March, Mr. Okeefe underwent a surgery and for the malignant melanoma on the right shoulder. Now, uh, on 17th March, he was discharged as he showed good progress. Yesterday, He was showered, obviously by us. But again, I don't have to write. And wound was dressed. Now write only. Now the word count. See, it's already high. It's already going high. So you can't write too many things. So you have to understand these simple things. So I have to tell the background of the patient. He underwent malignant melanoma. He was discharged. Yesterday he was visited. This is a very important word. I can say he was visited means by us. He was visited and was showered and his wound was dressed. Now he was visited and showered. If it is disturbing me, I will put it. His wound was dressed. Now write only main things. But his wound was dressed and there was no infection. So write progress. This is medical progress now. However, now tell the main things. However, his wife reported, again second form, past, reported that he had not been himself and they were unable, can't write are, they were unable to manage their house and garden. Also, dishes were piled up and it was dirty and whatever was dirty. Today, again, the nursing care has been provided, but still this word, common words, but still the house condition is not good and they are finding it difficult to cope up. So you don't have to write everything. The better form is that you write yourself. In a way, obviously, you have to consider these words. You can pick up the words like house is still disorganized. Dorothy says she would be lost without the help of the neighbors. So you can write all these things. So, but yeah, I'm trying to make it shorten. So they are finding to cobble up. Therefore, it is requested to you to, I'm writing to the director of the aged care to send someone from your team for their assessment regarding managing the house. You can write the concern parts and garden. Further, they need assistance with shopping and gardening as well. Whatever the word is, shopping and cooking as well. Khatam, that's it. Should you require further information, feel free to contact. Any other information, feel free to contact. But again, there is one specific point. Yesterday means 18th. So means when you will start the letter, how would it go? Uh, it's whom are you writing the letter? I will write the complete way of writing it. Director, aged care team. Okay. So director, aged care assessment team, BSR, whatever. Oh, this is a long address. So you can write it, but I will write it for you. The director. That is how you start the letter. Aged care assessment team. That is the way of writing the OET letter. So today we are discussing, so I want to discuss it in complete things. Then you can write the rest of the lines. In the next line, Brisbane South Region. In the next line, 17th Street. In the next line, Acacia Ridge, Brisbane 4110. So you can write over here step by step. Today's date, you should write 19th March. So by chance the date is given wrong, March 2012. And then you will write regarding Mr. Okeefe, his age, aged 83. Or you, if you don't, if you're not comfortable with counting the numbers age, then you can write date of birth. What was the date of birth? Let's see. What was the date of birth? 2 February 1929. 2 February 1929. That's it. And then you write, dear sir, ma'am, dear sir, madam. Sorry. That's it. That's your complete letter. Should you require any other further information, feel free to contact. Should you require any other information, feel free to contact. We'll stop. Yours sincerely, sorry, faithfully. Name is not given of to whom you are writing the letter. So I think we put yours faithfully. Registered nurse. And now you write your address as well. So what was your address? Blue Skies Nursing Home Center. Okay, so if you will see overall, it takes around 20 minutes to write a letter. That's it. If you don't get confused, if you don't overthink, and you can put it this, I will put it little smaller so that you can actually see the format of the letter. So that's the. So you can make 3 or 4 paragraphs, not a problem. And now if you will count the word count, if I tell you the word count, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, around 14 words. So it should make around 40, 42, but not complete words. So it should be around 42, 42 again. I'm just considering maybe 50, then around 28. So 40 plus 40, 80 plus 50, 130 plus around 30, 170 plus 30 around this. Way more than that, but it's already 200 words. So you can well imagine that we can't write more than that. So this letter is a very special letter in understanding how to manage the data. And you should not write overthink. The more you will panic, the complex it will become. The easier you will write, the more marks you will get. So in this 20 minutes, I have told you about the grammar, that in the past was plus third form, physiotherapy was given, hydrotherapy was given, this was done. In the present, you can talk about physiotherapy has been given, patient has been found with this thing, patient has been visited at his home, and like this, nursing care has been provided, but still the house condition is not good. Why to repeat all these things again? Finding it difficult to cope up, therefore it is requested to you. Main purpose, managing the house and the garden. Further, they need assistance. Sorry, by chance. Yeah, they need assistance with this and this. That's it. So you need to know, you need to understand that they are already, the main purpose is not medical this time, because their concerns is about house and garden. We are there to provide the nursing care until 24th. And we are not writing to nursing community health center. We are not writing to them. We are writing to aged care assessment team. So the first thing always is to understand to whom you are writing the letter. This time also, the last exam just now, respite care again came. Respite care is a letter that we, being medical professionals, write to one more medical professional that this patient is there with me for a long time regarding cancer or problem like this. But for the short term, I am sending him to you. Respite care means temporary care of a patient who is my patient, but I am telling some professional to provide him temporary care for the short term relief. So please understand these things. Again, listen to this letter again. Guys, it's all about patience in life when it comes to learning. So practice can be done obviously, but it's about learning. But and if you want to learn, so for the learning, obviously you have to be there and you have to mark your things. Thank you very much. This is Dr. Bhupesh from Dr. BKM OET Institutes. Now we'll discuss things. Thank you very much.